When we start a patient on PEEP, we're going to start low and say 5 centimeters of water pressure. We're going to watch the patient's saturation, and we're going to watch the other vital signs of the patient. So let's say that we start at 5 and we've got a patient with a saturation of 88, which is not great. We want to go up on that, and a normal blood pressure. Now let's say that we go up to a PEEP of 6, 7, 8. As we're going up, we see the saturation going up 92, 93, 94. Now this is we're giving it a minute or two during each increase. And let's say that we've got a PEEP of 12 with a saturation of 96. Okay, that's good. Let's say we move up to 13, and suddenly we see that heart rate increase, that blood pressure decrease, and the saturation begin to decrease. And you're just going to see the patient immediately decline. That we want to, of course, immediately go back down in PEEP to the highest level that the patient tolerated. We want to make sure that all of the patient's vitals return to normal and that saturation does come back up. And that could be considered that patient's optimal PEEP, at least at that moment. So in the patient we just discussed, we're looking for a PEEP of 12. Now we do want to constantly be monitoring the patient's cardiac output. A patient on a ventilator must be monitored at all times. We have alarms on the vent. There are going to be alarms on all of the vital signs that are monitored, and it's very important to be watching these things at all times.